My name is Dede, and I am a patient care coordinator with Amari Hospice. I'm involved in all the admission process when it comes to bringing a patient on. Sometimes I'm having to talk to families about what hospice is about, the differences between hospice and palliative care, ordering DME, scheduling clinicians, talking to families all day just about PRN visits and facilities. Um, Kind of like the hub point for traffic control. That's kind of my job. I'm like the person standing in the middle with the red thing and just like, you go this way, you go this way, you go this way, just trying to make sure that everything stays flowing and patients are being seen and everybody's being scheduled. Whatever needs to be done to make sure that everybody's day runs smoothly. First thing people hear hospice, they think, well, I'm not about to die. Well, of course not. Well, we don't know when we're, going to take that next step into the next life or whatever your beliefs are. But when I talk to families that have that hesitation about hospice, I explain to them, there's a lot of people who live with terminal diagnosis for years. I was like, it's just all about how you want your journey to go moving forward. This is like really your best life. I was like, you see those movies and they're like, they get that like your wish list or the 10 best things. I was like, use hospice as a way to do whatever you want. And they're like, what do you mean? I was like, we're not going in there to say, no, you can't do this. No, you can't do that. No, you can't have that. We're like, okay, let's make it work. And they're like, really? Because usually they're like, morphine. If you want to, it's your choice. It's your right. You don't have to take anything. Medicare and health insurance is confusing in itself. And so reading all that dialogue, like, it's so confusing. So just explaining all those little small things. And I'm like, and you can revoke anytime. This is not set in stone. Hospice does not put you in jail. Like, I'm like, you're still living in your own home. Like, you're the boss. We are just here to guide you in the right direction. We have a great office team, and with all of us together and all these eyes, like, we have our groups and our team. It's just everything. Everybody makes it easy for us to control traffic when it goes to hospice. It really takes a group effort for everything to run smoothly. And I can't say that it's just me, really, because if the clinicians and my other office team members didn't help me or do the things they need to do, it would be chaotic. Not corporate agency, it does set us apart because we're able to give sometimes families a little bit more intimacy when it comes to caring for their loved ones. Some of the bigger hospice corporations, like, they don't have the time to give you that intimacy when it comes to sitting down and talking to things. But it's like, they probably have like 10 patients to see. They're not going to tell you that, but you can kind of tell in their body language a thing that they're trying to kind of mold through everything. When you're kind of working in a smaller family-owned business type agency, you get the guidelines. There's nobody over here like, because 30 minutes is this amount and this amount, we don't want people going over this amount. It's not so money ran. We're more patient family focused. But our nurses, I feel like, have that ease of being able to spend an hour and a half with the patient if needed, because they want to work through some things. Because, like, hospice is not all about managing the medications and symptoms. Yes, it's a big part, but it's also about emotions. It's about the caregivers. Like, it's a whole team effort. If your caregiver is stressed, the patient is stressed. And then everything can go awry. It's like taking the time to be able to kind of give that one-on-one for everybody in the home. And sometimes when you're in a bigger corporation type setting, you're not able to do that. There's so many employees, you don't even know who your team is. When you have, this more family owned, like, yeah, we don't see each other every day, but everybody kind of knows. Everybody, the families know you. Like, they call and be like, oh yeah, hey, I've talked to you. Like, how you doing? How's the family doing? You get those small interactions that sometimes you just don't get. Whoever their automated system answers the phone. Here, you probably get the same 4 people every single time. And families like that consistency, knowing that at least there's one person that they know that they can call directly and maybe get some type of clarity or some type of whatever there is they're seeking for, a resolution in whatever they're doing. The biggest thing I hear from families, the biggest concern is the morphine. You get morphine and that means you're going to die. Like the moment you take it, you're going to die. And so my personal experience with it is I have a uncle who has sickle cell anemia. And so, and he's younger than me. And so like all of my life and his life, he's been in and out of the hospital and crises and things like that. And now as an adult, he has crises and they're painful. Like they can put you into the fetal position. Like it could take you out. And he's on morphine daily. And I remember when they first prescribed it and I'm like, they're going to give you what? Like I had never heard, like I thought it was just something you get at the end of life. Like it's something you have to go to the hospital and get some drip or something. And when UC Davis explained to us, they're like, no, just like any medication in small dosage managed can help, anybody. And with his level of pain, like regular medications are just not going to touch it. And it was because it would, we'd give him all the things that they said to give him when he'd go into a crisis, and he would still end up in the hospital because the pain would be so bad that he just couldn't. He would just be in tears on the floor. Sometimes can't even talk because he'd be in so much pain. And so watching how morphine first helped him fast, like he would take it and like within like 5 or 10 minutes, you could start to see the calm. He would start to get calm. And like within an hour, like he'd be resting. And it's just like, wow. So I tell people, it's not an end all. And they're like, okay. And like I said, just because you're on hospice doesn't mean you have to have morphine. We won't order it. It's okay. Every day, every time you talk to a family member, either, right when they come on service or at the end of service, sometimes just even just day-to-day conversations. It's so rewarding. It's just all small little things that happen. It's just like, wow, like that's so exciting. Like we had a patient, she had, I think her 100th birthday the other day. And it's just like, oh my goodness, she's 100. And it's like, go ahead, young lady. Like I hope to be like you when I grow up. Joining hospice or coming on hospice, yes, it says that you have a terminal diagnosis and that, your road may be coming to an end soon. Embrace that. Live life to the fullest. This is your time to live your life judgment free. Don't let anybody run you. You are the boss. And let us or any agency help you and advocate for that, no matter what it is.